Good evening everyone. Today's OSPE is for anthropometric measurement of height and weight. Common questions which could be asked in OSPE is what is anthropometry? Demonstrate the steps of anthropometric measurements. With certain OSPE station checklist. As per CDC, anthropometry is the study of measurement of the human body in terms of dimension of bones, muscles and adipose tissue. There are certain common anthropometric measurements like height or length, which is used or which is measured by stadiometer, infantometer or certain measuring boards. For weight, we use weighing machine or weighing scale. Non-strap measuring tape is used for head circumference, waist and hip circumference as well as mid-upper arm circumference. Herpendon caliper is used for measurement of skin fold thickness. Students should consider certain general principles before the starting of demonstration. He should introduce himself or herself and explain the procedure to the patient or subject or the parents of subject. He should obtain consent and ensure privacy and comfort of the subject. Always calibrated equipment and standardized technique should be used, and all the measurements should be done accurately. All measurement except skin fold thickness should be taken to the nearest of 1 mm, but skin fold measurement or thickness is taken to be nearest of 0.1 mm. First, measurement of length. I will cover measurement of length for a child who is up to 2 years of age. The recumbent length should be measured for these infants and the toddlers who are up to 2 years of age. We need 2 people. The parents or caregiver should be as close as possible to soothe the child during this measurement. We should repeat the measurement twice and average value should be recorded. In this slide, steps of measurement of length are given. First, we should align the infant's head against the top of Frankfurt vertical plane of the infantometer with the body in supine position with shoes and socks removed. Then, infant is positioned along the center of device or infantometer with the footboard against the sole of feet. Finally, an assistant must straighten the infant's body and leg, ensuring the feet are parallel to the footboard, straighten knees and keep ankles in neutral position. And finally, the measurement should be taken twice. For height assessment of children more than 3 years, we use stadiometer or an anthropometric rod. The stadiometer is mounted on the wall for the purpose. We should raise the horizontal bar to the top of upright bar. The head should be in Frankfurt horizontal plane, which is the horizontal line which is passing from ear canal to lower border of orbit, which is parallel to the Frankfurt horizontal plane as we can see in the picture. The line must also intersect the vertical backboard perpendicularly. The reading should be noted to nearest 1 mm and the measurement should be repeated twice and the average value should be recorded. These are the steps. We should raise the horizontal bar to the top of upright bar. Ask the child to remove the shoes. Heels should be together with the feet facing outward at an angle of 60 degrees and the child should look straight ahead. The child should stand up straight with occipital prominence, shoulder blade, buttocks and heel against the board of stadiometer. Finally, the arm should be loosely hanging by the side with palm facing the thighs. The horizontal bar or the headpiece should be lowered until it touches the crown of head firmly. And finally, the child should be asked to take a deep breath and stand as tall as possible. A deep breath straightens the spine and allows more accurate and consistent measurement of height. Now, measurement of weight. There are certain various type of weighing machine we use to measure weight, like beam type weighing machine, which is also called a detector scale, electronic weighing scale, Salter spring weighing scale, and bathroom type weighing scale. For weighing of infant, we should remove all clothing of infant, and infant can have a dry diaper only. We can weigh infant in supine or in sitting position for older infant. We should record the reading up to 0.1 gram. These are the steps of assessment of weight. We should move the weight to 0, or the pointer of the weighing scale should be in the middle. Ask the person to remove footwear, any kind of heavy item from their pocket, and remove any kind of heavy clothing. Ask the person to stand on the scale and move the weight until the balancer point is in the middle. While measuring weight, ask the person to look straight ahead and stay still on the scale. Then we should wait for the needle or the digital screen to settle before recording the measurement. We should record the measurement twice, and the average value should be taken into consideration. Finally, OSPE station checklist. The examiner should ask or should check whether the student have described and demonstrated the equipment, the person, the preparation, and correct measurement technique, like positioning of patient, whether he or she has recorded and interpreted the findings accurately, whether he has identified the importance and associated indications or implications, whether the student have reviewed the potential complication in performing any kind of assessment, whether the student have explained the clinical significance of performing an assessment, and the student have maintained hygiene, patient's comfort, and obtained consent from the patient. Various purposes for anthropometric measurements are: it can be used for assessing growth, body fat distribution, diagnose obesity, any kind of malnutrition and related health condition. Stature and weight used to assess the growth and development of child. If we do it repeatedly and plot it on the growth chart, then we can assess the growth and development of a child. Skin fold thickness and other circumferences can be used also for the cross-sectional analysis, and they can help in research and public health surveillance. Thank you for watching. These are certain websites